chronic, potentially life-threatening condition caused by the human HIV by damaging your immune system. HIV interferes with your body's ability to fight the organism that caused disease. HIV is a sexually transmitted infection. It can also be spread by contact with infected blood or from mother to child during pregnancy. Hey roommate, can you accompany me to a medical expert? I have fever, fatigue, swollen lymph nodes, diarrhea, weight loss, cough, and shortness of breath for a couple of years, and I've been bearing it, and I think I cannot bear it anymore. No, of course not. Those are actually early symptomatic of HIV infection. Who knows if you have those virus? STDs are generally acquired by sexual contact. The organisms that cause sexually transmitted diseases may pass from one person to person in blood, semen, vaginal, and other bodily fluids. Signs and symptoms that might indicate an STI includes sores or bumps on the genitals or in the oral or rectal area, painful or burning urination, discharge from the penis, unusual or odd-smelling vaginal discharge, unusual vaginal bleeding, pain during sex, sore swollen lymph nodes, but sometimes more widespread, lower abdominal pain, and rash over the trunk, hands, or factors that may increase that risk includes having unprotected sex, oral sex, having sexual contact with multiple partners, having a history of STIs, anyone first to have sexual intercourse or sexual activity, injecting drugs, abusing alcohol, or using recreational drugs, men who request prescription for treating erectile dysfunction. Anyone of any age, race, sex, or sexual orientation can be infected, but you're at greatest risk of having HIV or AIDS if you have unprotected sex, have another STI, and you use intravenous drugs. As sexual activity is the most common factor of HIV and STD, all should be vigilant and eligible at the most early time before engaging in such activities. Thus, the implementation of sex education in high school curriculum. Why this stage? Because it is during this time that they hit puberty and curious in how their body works. Through this, safe sex in numerous methods to protect themselves from diseases are learned. Whenever we hear of PLHIV/AIDS in the vicinity, most of us in the Philippines distance ourselves too much, to the point that we choose not to be associated or share a room, nor even talk with them. Yes, it is true that such diseases are actually contagious, but take note that those are transferable through blood and body fluids from sexual interaction, not through saliva when talking, nor through smiling at them. You might think that we are just plainly protective with our action, but we do not know that we are actually insulting them and adding to their loads. They are going through a lot, and it's important for us to know that our smile matters.